This is a tutorial on the reflective practice statements in the portfolio. We ask that you use the templates that we have provided and leave all the prompts in place. Firstly, to ensure that you don't miss anything, but it also makes it easier for us to mark. During the year, you are required to complete 5 clinical, 1 cultural, 1 ethical, and 1 evidence-based reflective statement. Each of the reflective statements has a different template or format with questions that are specifically designed to pull out the relevant information. It's important that when you're writing these statements, you know that when we are marking these reflective statements, we are not marking your behaviour, we are marking your ability to reflect. So let's look at the mark sheet. This is the portfolio mark sheet. The most critical criteria for the reflective statements is this one: to demonstrate the ability to reflect and demonstrate learning from experience as required by a physiotherapist. This criteria, understanding impact I have as a student physio on the patient, family, and within the healthcare environment, is also mainly marked in the reflective statements. So it's very important that when you reflect, you make sure that you reflect not just on the impact on you and your behaviour, but also the impact that your behaviour could have on others. Professional behaviour is a theme that runs throughout the portfolio and is marked on every element. There is a contribution from every element. To help you to understand what we want from a reflective statement, we have written some guidelines. These are found on Blackboard. There's a little bit explaining what reflection is and why it's important. There are also examples of what kinds of things we might expect to see under each reflective statement. One of the critical areas, thinking back to the mark sheet, is the potential impact for the service and those involved, and how do you know? So this is where I would consider the patient, my supervisor, the service, whānau, and actually almost have a checklist that I considered the impact from each person if you want excellence. At the beginning, we expect a brief summary of what has happened, an evaluation. These are the good points of your practice and the not so good points, reflecting from other aspects, other people, and then critically, what have you learned from the experience? When you're considering what to reflect on, it's very important that you consider something that is broad enough that you're going to be able to do write enough things in this second half of the reflective statement. If you choose something that is maybe very, very impactful and very critical, but only has a one-liner kind of learning point from it, then it's probably not a very useful thing to do a reflective statement on. Those kinds of things stick with you and you will remember them, but they don't need that careful analysis, that careful critique and breakdown. It might be better for the clinical reflective statements to choose just a normal practice, just a normal a subjective assessment or an objective assessment or a whole session where you can really pick into the nitty-gritty of what went well and what didn't go so well, and the effect that it has. Avoid those one-liner situations to reflect on, because it's very hard for you to pick out what further learning you can do. It's very hard for you to say what you can do to upskill if your only response is, well, I won't do that again. choosing a standard piece of practice to reflect on will also help you to learn um, from practice. Um, Being able to critically analyze each element of your practice is what drives you to be better next time. So we have a couple of examples of clinical reflective statements. And then we have some cultural reflective statements. It's very important when you're picking a cultural reflective statement, you don't just purely think about somebody of a different ethnicity. Cultural differences can be anything from gender, religion, age, sexuality, life, socioeconomic status, education. Don't reflect on something purely that's a language barrier. That is not what we want from a cultural reflective statement. Here, the student has reflected on somebody who is a child, on a child and the differences, and you're asked to consider the differences between yourself and the individual you're managing, and what you informed your perceptions. The important thing is how this cultural difference between you and your client, or you and the whānau, affected your practice. And did it affect the service and others? And this is where, again, you need to try and make sure that you reflect not just from the aspect of you and your patient, but you actually think beyond, think more widely in order to achieve excellence in that marking criteria. What have you learned from the experience? And then this is important. This is all about the better learning experiences, the more that you can draw out of a learning experience and think, it may not be a priority for you to do, but actually, if I really want to get better at this, then I could go and do a course. If I really want to get better at this, then I could go and read that book. If I really want to get better at this, then I could go and practice with somebody who works in that field more, so that there's the immediate learning, and then there's maybe learning like how much further, how much deeper could you take this. When for a really excellent reflection, it's that depth, it's that taking it beyond. How can I extrapolate on this? Where could it go? That's what we're really looking for. Here is another cultural reflection for you to have a look at and get some thoughts, and just see what kinds of things that we might expect to see. And here is an ethical statement. Ethics might include decisions to treat or not to treat, issues around consent, and issues around health literacy and how that impacts on consent. There's a lot of things that you might come across that you could use here. In the portfolio guidelines, again, we give you an example, and it's good to point out here that this is about your feelings, but also, again, thinking about the impact on others, so that the more thorough you can be here, the more highly you will grade in that criteria. And this is thinking about the supervisor and so on. And the service, and as broadly as you can think is good. And again, thinking about what you have done and what more you could do in the future, should that be the priority for your learning. In an evidence-based reflection, you're asked to identify an article, explain why you read it, describe or summarize the key messages from the article, critique it. So here they've used the Quadus tool, but you could use there are multiple tools that you could use depending on what type of article it was. And I'll just show you a link to something on Blackboard that will guide you in this. So on Blackboard, under the Wellington Centre, and then if you look for Professional Studies Week docs, And then if you look at how to evaluate the evidence for clinical situations and for course requirements. This document provides you with lists of checklists that you could use in your evidence-based reflection. Okay, so there's some different systems for critiquing evidence. You may be familiar with some of them, you may not, but that's something that you could have a look at to help you with your evidence-based reflection. After critically appraising the article, you're then asked about how it will influence your practice. So in light of the quality of the article, is it something that you will employ, or is your clinical situation different in some way? So actually, although you read the article, it doesn't actually help you very much. So this is the bit that we want you to discuss and talk about here, whether or not reading that evidence informed your practice and changed your practice. And clearly, depending on the situation, it may be that it's positive and yes, it's going to really impact, or maybe you found that on careful consideration, the quality of the evidence was not high enough, or the situation was not similar enough for you to want to change your practice. So it could go either way. I hope that's provided some useful insights into our expectations for reflective statements. Please don't forget, we do want you to use our format